Oh my goodness, what a difference a couple of days make.
Professor Noel Fitzpatrick
All right, missus. Cuddle monster incoming.
is the Supervet.
We have issues. I knew I should have got chihuahuas.
At his unique vet practice, he merges mechanics and biology.
Past the point of no return now. Don't be pulling apart my repair, missus.
To heal the nation's pets.
Sorry about coronavirus.
Oh, because you're responsible?
I'm responsible for almost everything else.
Even in the darkest days,
I'm so sorry this has happened to you.
Noel imagines the impossible.
Oh, my little baby girl's leg.
Oh my God.
Let's go. Sometimes you have to bend the rules of mechanics to fit the biology.
And offers hope.
We've definitely made the right decision. Good boy. We've got my boy back.
For families and their friends.
Look at you! Bionic doggo!
Yes, mate, I love you too.
Fitzpatrick referrals see many families who are prepared to go to extraordinary lengths to help their furry friends.
I think you're the only person ever that has just turned up from Germany.
I said, okay, we go. We drive to England to Fitzpatrick.
We've had patients from Russia. We've had patients from Europe and America.
Now I've got to go to Portsmouth and then we've got a 12.5-hour boat trip.
Where are you guys going?
We're Guernsey.
Oh, Guernsey.
I'm not at all surprised at the lengths that people go to for their animals because I know that I would do exactly the same.
Right, Kylo, that's us.
The McCann family is no different, having undertaken an 800-mile round trip to see Noel. Erin, Cara and their parents Paul and Suzanne have brought in Kylo, a 10-month-old rough collie.
We've travelled from Glasgow, travelled down last night. Kylo's kind of used to travelling in the car since he's been a young pup, so he's kind of used to the journey, the bed in the back.
In the McCann family, Kylo is used to being the centre of attention.
He's a good boy. He thinks he rules the house. He's got me wrapped around his pinky. Whatever he wants, he gets. We've had him since he was, 8 weeks? So yeah. He's just such a lovely dog. He's always smiling. Let's go back at you.
The McCanns have always loved rough collies.
Before Kylo, we had Kyle, and Kyle took really ill just over a period of 24 hours. He had cancer, and it just really appeared quite quick. But basically, they tried to save him, then they thought, no, it's better if he just goes to sleep.
So that's within the space of like 48 hours that he was no longer with us. So.
Losing Kyle left a big hole in their family.
The house was just so quiet, and at that point, Paul had then decided that it was probably time to get another dog.
When we first met him, he just cuddled in. He was quite small. He was just a wee ball of fluff.
But it wasn't long before the family noticed that both of Kylo's front legs weren't growing properly.
You just looked at his paws and they just bowed, so you knew there was something seriously wrong. When the specialist examined Kylo, he felt it'd be better if we were referred to Noel Fitzpatrick because he thought they would be the only people who could possibly do something for him. What we're looking for in Kylo is to give him as much a pain-free life as possible and as much normality for him as a young pup for the rest of his life. If Noel can't do anything, then we just don't know what's round the corner. It's basically, Noel is definitely a last hope for Kylo.
When I saw Kylo a few weeks ago, we took some X-ray pictures and a CT scan of both forearms, and we can see quite clearly here where the ulna did not grow at the same rate as the radius. And that meant that the radius bent, it twisted, it pushed the radial head out of the joint. He was in an awful lot of pain because he's being pulled apart by biology. That's called the bowstring effect. In order to prevent the deformity getting worse and to give the family some time to think about what best to do, I've taken a section out of the ulna here.
Although removing the section of ulnar bone will prevent Kylo's deformity from distorting further,
Hi guys, how you doing?
the family are keen to see what more Noel can do to help him.
Come on in.
Come on, Kylo.
But Kylo has other ideas.
There we go. You want to pick him up, Dad? Give him a hand. Give him a hand, guys. Give him a hand. There we go. Going straight through the prep.
Kylo is sent for a CT scan while the family consider their options for possible surgery.
Now, Kylo has a very complex deformity, specifically a radial head subluxation, which is where the head of the radius comes out, a radial deformity, which bends the wrist out, and both of those are contributed to by short ulna syndrome and severe erosion of the inside of the elbow. The inside of the elbow is being eroded for 3 reasons. 1, the deformity is pushing the paw out, so there's increased weight on the inside. 2, the elbow doesn't fit together properly. And 3, there's a primary cartilage deformity inside the joint where the cartilage is flaking off. And that produced a hole inside the joint.
Oh, he's so cute.
Kylo's scans are ready for viewing.
Right, there's no big surprises. He's more or less completed his growth. So this is now a final shape that I can work with. Now, we don't have to do anything. The choice is yours. Will the left get worse without surgery? Yes. Will the right get considerably worse without surgery? Yes. My plan is to shift this mid-segment back under the humerus over here.
Okay.
And then to move the entire paw that way, so that that's a straight line.
Okay.
Now, it's not as simple as that because there's tissues and blood vessels and nerves all around that. It's not easy surgery. If we go down this route and the implants fail or we get an infection or something horrible happens, Kylo is unlikely to cope well on 3 legs.
Okay.
And therefore, we may end up with euthanasia. You have to know that.
Good boy.
Because of the complex deformities, Noel will submit Kylo's case for ethical review before any surgery can take place.
We have what's called an ethics review panel.
Okay.
And that includes vets that are outside of this practice. Everybody will have a view on that, and they will decide whether, in their opinion or not, Kylo should have treatment.
Okay.
Some will say Kylo should be put to sleep. Some will say that Kylo should have a chance. You get a copy of the ethics review now, which shows you what our plan is. That's for you. Okay, I'll get him for you. Now, here we go.
Last time we were down, we never really knew if they could do anything for him. But now we know there is something they can do, so hopefully just try to be positive. Without Noel, there wouldn't be any hope at all, because there's nobody in Scotland can do the surgery he needs. So really, Noel's gave us hope.
Because Kylo has osteoarthritis and complex deformities, my concern is that the independent ethics review panel may feel that euthanasia is the best option because his prognosis may not be good enough. And then it's out of my hands.
It's late morning at Fitzpatrick's, and Sasha, a golden retriever puppy with a deformed front left foot, is scheduled for an assessment with Noel.
Sasha is literally Lady Wigglebottom. She is excitable, loving, gentle. She doesn't have an aggressive bone in her body.
When I bought this car a few years ago, it was definitely like dogs I envisaged in the back rather than children. So yeah, we don't plan on having children. This is it. We're going to have golden retrievers. She's our baby.
Sasha lives with her 2 mums, Karen and Eleanor, in Watford.
A friend of ours had said that there was a lady having puppies, and we thought, well, we'll, go and have a look. Didn't have a look. came home with Sasha. She brought out the 2 little girls that were still looking for a home, and she came running up to us straight away. I've always said to people, we didn't pick Sasha, Sasha picked us. She did say, look, you know, obviously she's got this foot that doesn't look like it's developed properly. It didn't really start to show an effect until she was growing quite significantly.
But as she's grown, the lack of properly developed toes on her front foot has left Sasha struggling.
It started having a height difference, and that's when we started looking into options. I'm concerned that maybe she's going to take a tumble and hurt herself, or not be able to stop if somebody's riding a bicycle and she gets in the way, or she's headed towards a car, she's not going to be able to stop in time. So the risk to injury is definitely getting higher and higher.
Noel has already seen the primary care vet's X-ray pictures of Sasha and may have a solution.
Please grab a seat there, girls. Thank you. Very good. Now, tell me, first of all, what the history is. Hello, sweetheart.
So we went to go pick her up from a lady in Belfast. When we got there, she did point it out. She said, oh, it's probably just from one was inside the womb, or maybe she nibbled it off. The mother nibbled her toes off.
Okay, cool. Let me have a look. We've seen on her X-ray picture that she has spiky bits here, which are the metacarpal bones. And those spiky bits of bone are going into this pad. The question is, what is ethically right for her? That's really the question. Right, girls. So look, you've got the following options. Leave her as she is. Option 2 is design something to go on the outside that's going to help. Option number 3 is attach something directly to her skeleton to give her an endoprosthesis and an exoprosthesis. Option number 4 is take the leg off completely. With regard to option 3, which is skeletally anchored endoprosthesis, yes, I'm the only person at the moment in the UK that does that, but that does not mean I do it all the time. And nor does it mean that we ever do something that isn't in the patient's best interest, because that's the only interest. The main issue for her is the discomfort which arises from the sharp ends of her metacarpal bones digging into that main pad. Now, you seem like very patient people. Patient people are generally patient with what we call donning and doffing. A false leg in a human is donned and doffed, put on, and taken off. It's a so-called stump socket prosthesis, an SSP. Would you want to consider something that we might be able to make that you could don and doff?
Definitely.
Why would we put her through surgery if we don't need to?
Yeah, 100%.
I work with a prosthetist. I think it would be good to have the guy here at the time we do the CT so he could do his casting and stuff like that at the same time.
Yeah, definitely.
Yeah.
Thank you so much.
No problem. It's an absolute pleasure to see you. Goodbye, sweetie pie. Well done.
Thank you very much. Thank you for your time.
Thanks so much. God bless.
It'll be 6 weeks before Karen and Eleanor
she's so beautiful.
are back with Sasha to discuss her prosthetic attachment.
Sorry, I've got a golden retriever.
I'm elated that it's not a case of her needing to have massive surgery, because first of all, it's traumatic for them, and secondly, so much can go wrong. If it failed, she'd end up losing her leg, and she's not even a year old yet. So it's good.
It's been an anxious 2-month wait, but the plans for Kylo's complex surgeries on both his front legs are now complete.
Would you like to come in?
Yeah.
And the decision of the ethics panel has been made.
The independent ethics review has approved Kylo for surgery.
I'm having to carry you again. Oh, I thought that might be the case.
But if a catastrophic failure were to occur, either because of mechanics or biology, then amputation is not an option, and sadly, we may have to consider euthanasia. You can take him through, Lauren, thank you. Come on, big guy.
Kylo will have his first surgery today and his right leg operated on in 8 weeks' time.
This is Kylo. He's a good boy.
2 major ops and 2 800-mile round trips, all with the knowledge that if anything goes wrong, Kylo could be put to sleep.
We've planned this very carefully inside the computer. So you can see from this diagram, we're still left with a kind of S-shaped bone, which is why you've got an S-shaped plate. As we move the muscle and the blood vessels and the nerves around, there is a possibility that a blood vessel or a nerve could get damaged. Now, I've personally never had a nerve not come back, but I have, on a couple of occasions, had a blood vessel not come back. But it's very rare. The other risks are mechanical. In other words, the screws could fail, but I think it's unlikely given how highly engineered this is, okay? I know, look, it's upsetting, but I have to tell you this, don't I? What can I do? I'm sorry. Sorry. It's not likely that something like that's going to go wrong, okay? Yeah. I think if we can get the legs aligned, that the impact of his osteoarthritis will be copable with for him for the foreseeable future. He's a fluff monster. And I know it's very upsetting for you, but you have to put it in the context that we just need to get through these hurdles to give him as pain-free and as normal a life as possible.
I think we're all upset, kind of letting them go.
Nah, it's not very nice. You do worry, but you just look for the end result and think positive.
The toes need doing.
Oh, no, the toes are fine.
We're going to operate on Kylo's left front leg first. And of course, the objective is providing quality of life, which means good function without pain. All right, let's do this.
Noel will use a 3D printed guide to drill holes into the radius. He'll then place pins onto which further guides are fitted to allow him to cut the bone at the correct angles, both top and bottom. Next, Noel will cut the ulna at the same levels before attaching a custom plate to the radius using non-locking screws, pulling the segments into alignment. Finally, he'll place locking screws and reinforce the repair with a second custom plate.
When was his birthday?
3 days ago.
Kylo, happy birthday, my friend. That's amazing. Straight legs and no pain. That's a good birthday present.
Having drilled holes for the plates, Noel then makes a series of cuts using the guides to remove a wedge of bone from either end of the radius.
So now we've taken a second wedge out of the bone. And what I've got to do next is I've got to cut the ulna. You've got to be careful not to cut any major vessels here. Okay, so we've completely mobilized the middle segment now. I've actually never designed a plate like this in my career before. It's a very, very unique plate, custom made for Kylo. The ability to three-dimensionally print plates with multi-directional locking screws is a revolution. Certainly 30 years ago when I graduated, I would have said nothing can be done. But now almost everything is possible, as long as it's ethically in the patient's best interest. We slide it down under the muscle and anchor it to the top end. Then we simply line up the holes that we've previously made. And if the calculations we've made are correct, the leg should then be straight.
The plate is then locked into place.
So we're putting a second plate down the bottom part of the radius here because Kylo's a big dog, so that he doesn't break anything. So as we can see, the leg is straight and the wrist is parallel with the elbow in the sagittal plane and also in the transverse plane. Right, Kylo, you in there? Good boy. X-ray and CT, please.
If the operation is successful, Kylo will have the procedure repeated on his other front leg in a couple of months' time. The CT scans show the implants are in the correct position. The hope is they'll stand up to the mechanical stresses in the newly aligned leg.
Come on, let's go this way. Good boy.
Karen and Sasha the puppy, with a short left front leg, are back at Fitzpatrick's to discuss a non-invasive solution for Sasha's deformity.
That's you.
Alan, the prosthetist, has come to see what's possible.
My work usually involves treating humans. We've done 2 or 3 different legs now for Fitzpatrick referrals. It's interesting because it's very different from humans, but then when you actually look at the skeleton itself, the skeleton's actually really, really similar. One small and furry, and the other ones stand up on 2 legs and talk.
Well done, good girl, good girl.
Hopefully it'll just be something that they can make her that gives her a little bit more comfort and prevents her from injuring it.
Well done, good girl, good girl.
The challenges involved in producing a prosthetic for an animal is actually the size of it. The manufacturing process of them is very intricate and difficult.
I have no idea what it's going to look like. I've got this sort of sleeve idea, but it might be just a little clip-on shoe of some sort.
So what we've got is a definitive length difference, which we can see because when the carapace is at the same level on both sides and the elbow is at the same level on both sides, we're missing that much.
I think if we can get a mould that goes around that and just holds on with the shaping that we've got at the bottom there, it could hold on really neatly.
Yeah, all right, great, thanks. Let's sedate and go to CT.
Scans of Sasha's front leg will help the team create a 3-dimensional model from which Alan and Noel will design her prosthetic.
So my idea, I've just been sort of churning it over at the moment. We're going to have to come up relatively high. Because then we're going to have to mobilise that joint.
This is problematic. And I was just wondering whether I should do surgery to take that off today, because that would make your life easier as well, wouldn't it? Because if we get a pressure sword there...
No, you're right.
I think we get rid of it already.
Totally.
Perfect,
I think that's it.
Perfect. All right, good.
Right, see you later.
Noel plans to remove Sasha's dew claw to prevent irritation and improve the fit of the prosthetic.
The dew claw in a dog is effectively the thumb, and in Sasha's case, because we're going to be putting on a snugly fitting stump socket prosthesis, I'm concerned that irritation or infection could happen. Come on in. So we've had a look at this leg in great detail now, and what we can tell you is that this is not a chewed off by mom. This is a congenital deformity. And the reason we know that for sure is because you've got 2 fused metacarpal bones here, which is a genetic deformity. These nooks and crannies are very useful for holding the silicone. Because it means it's less likely to slip off.
It's got something to sort of wedge in with.
Yes, and I think it's going to be wise to take that dew claw off. So what I'm recommending is that right now we convert this sedation into a general anaesthetic. And we amputate that dew claw and get rid of it.
If it's going to be better for the long-term treatment, then better to come off then. I think since we saw you, she's probably not got too much bigger, but there's definitely, I think she's filled out a bit, and you can see that when she's sitting, for instance, she can't sit like Maya, who is her new adopted sister that we got about a month ago.
Congratulations, Maya.
Yeah, she's a rescue that we got from Turkey, unfortunately a product of a puppy farm.
We're doing okay?
She's perfectly fine, and she made such a difference with Sasha. It's just given her a companion and expanding the family.
Well done, you.
Thank you very much.
No worries. See you in a little while. God bless. So I'm going to take this dew claw off. If the foot remains uncomfortable inside the silicone liner, I may make an incision here at a later date and chop off some of the spiky bits of the residual metacarpal bones.
It's a simple 15-minute procedure for Noel to remove Sasha's dew claw. Now she'll have to wait for the prosthetic, based on her CT scan, to be made.
All right, thank you. Well done, Sasha. Good girl.
Kylo has recovered well from the surgery to straighten the first of his deformed front legs.
Getting him home after the first operation was great because we could see a difference in his paw. The paw looked nice and straight. Obviously, we had bought him a big cage in the meantime because he had to be restricted, and it was a shame because you felt as if he was in jail.
But Kylo is only halfway through and still faces a second major procedure on his other front leg.
We've just dropped him off again, and as much as everything's went well for the first operation, we really hope that everything goes well for the second, because there is still possibilities it could go wrong.
Oh God, it's such a pity with this beautiful...
I know, fur. He's clipped everywhere.
If anybody can do anything to help Kylo, it's definitely Noel. So, we are optimistic that he is in the best possible place.
But we just don't want to think of putting him to sleep.
Noel inserts the custom-made plates to straighten Kylo's second front leg.
What we should find now is if by magic that the wrist and the elbow are parallel, even though the bone is still a very peculiar shape. It's just beautiful, magical simplicity. Okay, we're going to stitch up.
It will be several weeks before Noel can be sure the second operation has been a success.
Well done, mate. Good boy. Well done, Kylo.
10-month-old rough collie Kylo is recovering at Fitzpatrick's after the second of his front leg corrective surgeries.
Good boy.
And he's become a Fitz family favourite.
Kylo is very loud, but very sweet dog.
Yeah. You tell her.
If he sees you looking at him, he'll start barking non-stop. You're going to the kennel to play, throwing his toy. He's very cheeky.
He recognised us immediately, and the second he saw us, he would grab his toy and sit on his back legs, barking at us just to say hi.
Telling us what to do, basically. We say that he's always talking to us.
You're so handsome, aren't you?
Noel is so pleased with Kylo's progress, the family are back to collect him.
Oh, good boy.
So we start out with that, which is a banana-shaped ulna and an S-shaped radius. And then we end up with this, with the humerus and the radius and the ulna in a straight line, and the carpal joint and the elbow joint parallel to each other. That's a revolution.
It's unbelievable.
And even for me, having done this for years, that's mind-blowing.
That's quite amazing, isn't it?
I'll bring him in.
Okay.
Come on, big guy.
It looks taller at the front.
He probably is taller, mate. I've just given him stilts. Right, let's go out to reception, a bit more room. At the moment, mechanically, I'm delighted.
Okay.
But remember, it's only the screws that are protecting his repair right now.
Yeah.
And he could strip him and he could fracture his bone if he were to jump out of the car or suddenly
I'll lift
run.
him up and down.
Yeah.
Thanks
okay?
very much again, Noel.
No
Thank
worries.
You.
Yeah, we don't want to put his good work to...
Yeah, to ruin. Things do look bright for him for the future, so everything seems good. See if you want the boot, I'll lift him.
Kylo still has a long road to recovery.
Everybody ready to go?
And the family once again face the long journey back home to Glasgow.
Did we go to a kennel?
She all healed up.
Yeah. She removed some stitches on her own.
Did you? That was naughty. That was naughty.
It's been 5 weeks since Sasha had her dew claw removed, and today she's back for a fitting for her unique prosthetic.
She's obviously grown quite a bit since we started this whole process, and the difference between the two limbs has become more and more obvious as that goes along. And just making sure that she has sort of a chance at just being able to get around as much as Maya does is key for us.
Alan has arrived with a prototype prosthesis to try out.
Don't think we could ask for a dog with a better temperament, for doing this?
Exactly. She's the best. No?
The design we've come up with is what we call a push-fit prosthesis. So we've got a soft foam inner, which will hopefully give her comfort while she's walking the leg.
Well done, sweetheart. Push the elbow down. It should get right down into it. Yeah, that's it. Good. That's it. Good.
The second component is the carbon fibre outer, which will give us the strength and rigidity that we need.
So that's carbon fibre?
Yeah, it's carbon fibre there. And then it's just a temporary foam at the bottom. So this should allow the leg to be put on and off easily by the family, but also for the leg to stay on well while Sasha's walking and running about in it. This is probably going to be too long, but this is where we can cut this down rather than add stuff on.
Yes, yes. Let's pop down on the floor.
It'll be nice seeing standing, you know, there.
Yeah.
You know, definitely looking at those elbow points there. We need to take a good chunk off that.
Yes.
10, 20 mil. Let's do that now. Right, let me take these back through to that other room.
Okay, thank you.
We need to wait. Come here. Will you? Mwah.
Let's have a little look and we'll see where we are. Actually, I think probably what we'll do is take a little bit off this back corner there to almost give it a bit of a rocker on it so that when she comes in, you know, it's a sort of rolling, because at the moment you've just got
Yeah. And it feels like a corner now. Like
yeah, exactly.
Alan will make the remaining adjustments
Come on, little Gracia. Do you need a baby?
before Sasha finally gets her new custom-fit prosthetic.
It's being tweaked, so we're going to come back for the final actual end product as such, but they did a few more measurements today, and they've made the height adjustment that it needed for her to be able to get it to the right height. So, very happy, yeah.
It's midday at Fitzpatrick's, and the McCann family have just arrived at the practice. 6 weeks after the surgery on his right front leg, they've brought Kylo back with serious concerns.
Just all of a sudden, we initially noticed that he wasn't wanting to put on any weight on the paw. He was kind of limping on it, so I thought then there must be an issue. But you can see it now, there's a big bump up at the back here.
I think it's definitely more noticeable when he's out and he's walking that he just doesn't want to put any pressure on the paw.
The ethical review has stated that amputation is not an option, and that if something serious has gone wrong, Kylo may still be put to sleep, and that decision could be taken out of the hands of Noel and the family.
I'll put my visor on in a second. So.
No, you're fine, don't worry.
Hi guys.
Hello.
Hello Kylo. So come on in then. There we go. Now, if you just turn him around, Daddy, and I'll just have a little look. Okay, we'll talk in a moment. Let me just check first.
I feel like a big lump here.
Yes, there. Well done, Kylo. Okay, good. You can take him through.
Good boy.
Thank you. You know what to do. CT and X-ray, both thoracic limbs.
Is that your Uncle Johnny? Yes.
The thing is, no, he's in the cage, he's out for a couple of minutes, he gets a walk and he's back in. So I just, for the life of me, couldn't work out what
I think this is what we call biological variance.
Yeah.
Now, okay, so if we're lucky, this bit will have held up and the radius head will still be attached to the radius body.
Yeah.
Okay.
If we're unlucky, the radius will have had something go wrong as well.
The images will reveal which scenario has occurred.
We can see that the left has healed beautifully and that ulna has gone on to heal. On the right side, however, The mechanical load was too great for the 3 screws between the top of the radius and the ulna, and unfortunately those 3 screws have broken.
However, Noel has a suggestion.
In my opinion, the surgery which is most likely to correct this is to get in and take those 3 broken screws out, reattach the head of the radius to the plate and put a newly designed plate and anchor it down here onto both the ulna and the radius so that all of the forearm becomes one bone.
Okay.
We will use the CT scans we took today to design the plate. What's best is for us to keep him here until the plate is done and we go back in and we do what's necessary. All right, guys, God bless. Look after yourself. All right, bye for now. Bye-bye, bye.
The McCanns are leaving Kylo at the practice until Noel can repair the complication.
I just think it's the best thing for Kylo to be in. I really want to see him, but I just know that he would have been too upset when we walked out that door. He wants to be a pup, you know what I mean? And I'm more concerned about, are we going to do more harm than good if we took him home? Because I'd want him home for the wrong reason. I'd want him home because we miss him and we want him there. But we need to put his well-being before everything.
Yep.
Do you agree?
Good girl. Come on then.
Ten-month-old rough collie Kylo is about to undergo corrective surgery after the complications with his previous repair.
Hindsight is 20/20, and next time I see a case like Kylo, because of this failure, I will do that operation differently. There is no question that I could have done better with Kylo. I'm going to go in and try and remedy that situation right now.
Noel hopes a further custom plate will be strong enough to counter the mechanical forces of the realigned leg. But first he must remove the broken screws and reattach the top of the original plate to the radius.
Because this is an anatomically contoured plate to begin with, even though the screws have broken, what I can do here is pick up the same screw hole with a new screw. Unfortunately, callus has formed already in the wrong position, which makes putting it back together very difficult. We're now going to try and pull the ulna back into position. Nobody has a crystal ball, and biological variance from one leg to the other, in Kylo's case, meant that the forces overwhelmed the mechanics. But I think it's a cop-out for surgeons not to take moral responsibility as well. Every success stands on the shoulders of failure, and it's my job to look in the mirror and sort it out.
Noel finishes attaching the new additional plate to both the ulna and the radius with locking screws.
So we're going to pack the bone marrow that we harvested into the holes now, and we're going to stitch up.
Noel has done all he can.
All right, Kylo, good boy. It's last chance, mate. Good boy. Well done.
The rest is up to Kylo.
Good girl, you're so good.
Yeah, she is. She's a beautiful dog.
Alan, the prosthetist, has made the final alterations to Sasha's prosthetic leg, and it's ready for her to try on.
Let's lift her down.
Sasha?
Well done, sweetie pie. Well done, Sasha.
Thanks, Lisa.
Good. Now look at your new foot, sweetie pie.
Here we go.
Let's see how you get on. Now look what we got here. Look what we got here.
Hello, Trouble. Look at you in your fancy shoes.
Look at that. Look at that.
What do you think? Come on.
Let's go this way.
Hey, let's have a look. Oh la la.
That looks good, doesn't it?
Yeah, she looks like she's going to Glastonbury.
She does. She looks like she's going to a music festival. You're quite right. What I want you to do is go for a 3-minute walk outside.
Perfect, thank you very much.
Off you go.
Come on, this way. Mommy, you're walking on your new shoe. Oh la la. Even running. Look at you. Oh la la. Come on, out of there. The first thing was that she came out like a little rocket. She took off down the lane and I could barely keep up with her once. So that to me is the sign of success, is that it's on, she's not noticed, and it's doing its job, which is amazing. It really makes my heart bounce.
After 2 long weeks without Kylo, the McCanns have come back to the practice to collect him.
It's 8 degrees down here. It's -3 up at Glasgow. So you're talking about 11 degrees of difference. Yeah, it's been stop-start now for the best part of maybe a year. So it's been quite a long time, so everybody's desperate to get them back home.
It was, I think, one of the most challenging limb reconstruction deformity cases that I've had in 20 years. I think there's light at the end of the tunnel now. There is no evidence of infection. With regard to the future of the cartilage and what's happening inside the joints, we won't know for another 6 months or so.
Okay.
There will always be osteoarthritis.
Yep.
But I think when you see him, you're going to be thrilled. Let's sit you out here because I want him to not slip on this floor.
So excited to see him. I've just missed him so much.
Now, who's here? Oh, there we go, there we go, there we go, there we go. Well done, guys. You see he's doing great?
Yeah, he's brilliant. Hi, Kylo. You ready to go home? Yeah?
Kylo is doing really well. Happy, seems to be pain-free, so far so good.
You inevitably build up a bit of a bond with them, a bit of a soft spot. You get to know them, and it's always harder to send them home. It's tough. Sometimes some of the nurses get a bit emotional, but it's very rewarding when they do eventually get to go home to their parents.
Kylo's so resilient, and hopefully he won't come back, so he can go and enjoy his life.
It's just good to get him settled back home.
He's in for a shock because he's getting back in his cage, so he'll not be too happy at that.
Hello, baby. Hello, my boy.
Lie down. Good girl.
In Watford, it's 2 months since Sasha received her prosthesis.
Ready? You go. Huh?
And now that Karen and Eleanor have mastered donning and doffing, nothing is holding her back.
She doesn't seem fazed by it at all. Sashi, this way! We put it on and she ran and ran and ran with Maya. It's literally pop on, pop off, as and when you need it. Before, we had to keep her on lead. You were always hesitant to just let her go in case she'd hurt herself, whereas now she'll take off along the fence with Maya and she'll be gone for ages and we think, oh, we're going to go fetch her because she's going to run out of steam. And then you'll see the 2 of them come tearing down the track, and often she's ahead of Maya. I'm going to go swim. Come on, Maya. Just means that we can carry on as normal. Noel has given us an opportunity to give her a full life. What are you doing? Are you fishing? And you could see the complete devotion to finding a solution without actually promising us anything that he couldn't deliver on. We are completely grateful for the fact that he came up with something that we can manage. So it's perfect, perfect for us. Come on, girlies!
After 4 operations and 6,000 miles covered, puppy Kylo is finally able to walk pain-free.
Where's Mr. Clock? Where's Mr. Clock?
Bring it, Kylo. Oh, it's great to have a boy back. It's unbelievable.
So he's had a lot of operations, but to kind of see him just now, it's remarkable. I'm thinking I'm having too much fun here.
You can see in him he's happier. His movement, he's happier, he's comfortable when he's walking. He's just so much happier all round.
Want some water?
Everybody just mucked in between the girls, myself and Suzanne. Everybody's there for each other. There may be some days I would speak to Suzanne if I was worried, and the girls would have their worries. So we've spread the responsibility between everybody. It's been a family thing. Look at your paws, Kylo. Nice straight paws, boy. It's been a long journey, a good 14 months. We've been through a lot, but for us, it's been more the dog that's went through it. We've just been the chauffeur.
It's going to be good now to kind of let him off the lead and play about and just do normal things that puppies would normally do, like a day like today where we're able to bring him out and take him off the lead and he's running about, he's playing with the kids, etc. So yeah, we definitely feel as if we've got our dog back.
Oh, Kylo. The results are actually better than we initially hoped for, and it's given Kylo his life back. Come on, Kylo.
He's having a good old time.